Pradaxa, manufactured by Boehringer Ingelheim, is the product name for Dabigatran, a blood-thinning prescription medication used to reduce the risk of blood clot formation in patients with atrial fibrillation, the most common type of heart rhythm abnormality. In the human heart, there are 4 chambers: the right and left atrium and the right and left ventricle. Atrial fibrillation occurs when the 2 upper chambers of the heart quiver, beating chaotically and irregularly. Due to the irregularity of blood flow in the heart during these events, pools of blood can form, and consequently clotting. If a blood clot forms, breaks free, and travels to the brain, it can lead to a stroke and even death. From October of 2010 through August of 2011, a total of 1.1 million Pradaxa prescriptions were dispensed to 371,000 patients throughout the United States. Currently, the FDA, the Food and Drug Administration, is investigating reports of serious bleeding events and nearly 300 deaths in patients taking Pradaxa that have been submitted to the Adverse Events Reporting System, AERS, database. While serious, even fatal events have been reported, the FDA is analyzing the events to determine whether the reports of bleeding in patients taking Pradaxa are occurring more commonly than would be expected. Overseas, Japan and Australia have issued safety warnings. The European Medicines Agency is advising doctors before prescribing Pradaxa to check a patient's kidney function.
Hello, I'm Howard Nations. My law firm, the law offices of Howard L. Nations, is a national pharmaceutical litigation firm with clients in all 50 states. And for the last decade, we've specialized in pharmaceutical litigation, suing manufacturers of devices and manufacturers of bad drugs. We're currently accepting litigation involving the drug Pradaxa.
Pradaxa is an anticoagulant medication similar to Warfarin, sold under the brand name of Coumadin. These drugs work by inhibiting the synthesis of clotting factors in the blood. The danger is that the therapeutic range in the use of anticoagulant medications is narrow, between too little and too much. Too little and blood clots can form, leading to DVT, deep vein thrombosis, heart attacks, and stroke. Overdosing can cause excessive bleeding, which can be difficult to diagnose, slow to progress, and deadly. Emphasizing the need for constant testing during the use of anticoagulants are health factors, patient to patient, that influence the blood-thinning properties of these drugs when administered, including liver and kidney function, diet, alcohol consumption, age, and prior medical history. Testing includes measuring the INR level, the International Normalized Ratio. If your ratio is too high, it means clotting does not occur quickly enough, increasing the rise of uncontrollable bleeding. If the INR falls below the normal levels, your blood may clot too quickly. In cases of overdosage of warfarin, patients have been treated intravenously with vitamin K, fresh frozen plasma, and PCC, Prothrombin complex concentrate, which, when administered, increase key clotting proteins in the blood to treat excessive bleeding or prevent it. However, with the use of Pradaxa, no standards or practices were established for blood testing to measure dosage levels. In fact, the drug was marketed claiming that frequent blood testing was not required or needed. And studies have indicated that intravenous treatments like vitamin K appear to be ineffective with Pradaxa overdoses, unlike Coumadin. With Pradaxa, there are no known reversal agents or antidotes. Additionally, A study conducted at the Cleveland Clinic reported that patients taking Pradaxa have a 33% higher risk of heart attack or severe heart disease compared to patients taking Warfarin. The results of this study were based on 7 clinical trials that enrolled 30,514 patients. The FDA recommends that patients not discontinue use of Pradaxa without consulting a physician. However, patients should be vigilant in recognizing signs of possible heart problems or internal bleeding associated with the use of an anticoagulant medication, which include unusual bruising or bleeding, pink or brown urine, red, black, or tarry stools, vomiting blood or vomit that looks like coffee grounds, or coughing blood. If these occur, seek medical attention. Have you or a loved one been prescribed Pradaxa, having suffered from atrial fibrillation? Do you or someone you know demonstrate the symptoms of excessive bleeding or suffer serious health consequences from this? Has a death from this occurred during the use of this medication? If so, you need to consider contacting a lawyer, but as important, a pharmaceutical litigation specialist. Howard Nations is a renowned trial lawyer, recognized as a super lawyer, who's been elected president of national and state trial lawyer associations, lectured to trial lawyers in all 50 states and 12 foreign countries. Mr. Nations has received numerous awards over the decades, the Warhorse Award, the Melvin Belli, and Clarence Darrow Awards. In this type of litigation, known as mass tort litigation, it is not a class action suit, where a group of claimants, sometimes in the thousands or tens of thousands, divide a sum of money. This litigation is what is known as an MDL, Multi-District Litigation, where all of the cases nationally are consolidated in one federal court, located somewhere in the country.
If you go to your local attorney and they filed your case locally, you will not stay in your local court, because when you have thousands of people or tens of thousands of people suing the same defendant, the same one pharmaceutical company, the federal rules provide that all those cases, regardless of where they're filed, will be moved to one federal judge. And it's very important for you to understand that you have to hire a pharmaceutical specialist in order to prosecute your case.
The plaintiff's case is guided by a plaintiff's steering committee, established by the court. In a lawsuit, the plaintiff first proves liability. Who is responsible? In a court of law, that is a costly undertaking, in the hundreds of thousands of dollars. In an MDL, those expenses are shared among all of the plaintiffs, resulting in a low cost to each plaintiff, making a claim even possible. After liability is established, then each case, each individual is considered in terms of damages and the amount to be paid.
We look at your case individually, we pull together your proof individually, we present it individually, we argue it at mediation individually, and we settle your case individually.
Have you or someone you know taken Pradaxa and may have suffered from the dangerous or even fatal consequences? Are you concerned about the future? Our firm offers a free evaluation